It's National Wear Red Day. The Cardiac Association is going around Gibraltar with these photo frames, raising awareness for that all-important ticker over here. We're here to tell you why.
It's the first Friday in February. February is the Heart Month, and we usually use the first Friday to create awareness. How do we create awareness? For us, it's getting people to wear red. And we initiated this idea a few years ago, whereby we have a roving frame. I think that encourages companies, businesses, and people to wear red. And we'll go around and meet you, have a photograph, put it on Facebook. And the more photos that we have on Facebook, social media is very powerful, the more we'll encourage people to basically look after their hearts.
Heart disease is a silent killer. Sometimes people don't know that they've got heart issues, high blood pressure, high cholesterol, and ultimately you have to look after your heart. People can suffer sudden cardiac arrest, heart attacks, and those hopefully can be prevented. Healthy eating, try to not stop smoking, lead an active lifestyle. So ultimately try to do your best with healthy habits and knowing your numbers.
Paying attention to those warning signs can be absolutely essential in catching heart disease or cardiac complications early, which in turn can make all the difference in treatment options and the eventual outcome. So what symptoms should we all be looking out for?
Speaking on behalf of professionals, they usually tell you, shortness of breath could be one thing, tingling in the left side of your body. In the females, apparently it's known that it affects your jaw. High blood pressure, if you feel that you're getting continuous headaches and your blood pressure is high, it's something to check. Blood tests are a good indication. It's usually if you've got your sugar is high, your cholesterol is high, maybe the body's giving you a warning that you really need to do something about it. So it's like Vanessa has mentioned, sometimes preventative is better than cure. So look after yourself, look after those signals and those warnings, and if you're feeling unwell, go and have it checked.
Now, some people may be inclined to bury their heads in the sand with this sort of thing. So a final message to those out there who perhaps ignore these potential indicators for longer than they should.
Don't do that. It is important to know what is going on. As we've mentioned, prevention is better than cure. So know your numbers, do something about it. That's the most important message that we can say. Look after yourself.
Exactly. If you're lucky enough to get a warning, then do something about it. Because the unfortunate thing about the heart is that sometimes it doesn't give you a warning. So if it does, count yourself lucky and take some action.